Okay, the bones of the lower leg and ankle. As we come down, you've got essentially the tibia, which is known as the shin bone. It's the weight-bearing bone of the low leg. And it comes down, and you can feel the end of the tibia on the inside of the ankle here. This portion, this kind of ankle bone, most people will call it, this kind of knot, it's called the malleolus. The medial malleolus because it's on the inside of her right leg. On the outside is a smaller non-weight-bearing bone, the fibula, and it runs down the outside of the leg, and its distal end again is called the malleolus. This is the lateral malleolus because it's on the outside of the leg here. In between the two leg bones, the bone that forms the hinge joint of the ankle is called the talus, and you can't really get to the talus to touch it, but it's in there, and that's the bones. It articulates or touches the tibia, and when we flex and extend the foot, that's the talus moving between the tibia and the fibula. Just below the talus is a row of bones called the tarsals, and there's 5 tarsals that come across the foot. This makes up kind of the midfoot. Within the tarsal bones, they all touch each other, and there's a little bit of motion between each of them, but not a whole lot. There's ligaments that run between all of those bones through there. Next, in the forefoot, it's 5 bones. These are essentially kind of the fingers, kind of the palm portion of the foot, if you will. These are called the metatarsals, and they connect the tarsal bones to the phalanges or the toes. The muscles of the leg, we look at the outside muscles. The ones that are most commonly injured and the ones we talk about the most are the peroneals. And they start out here all the way up real close to the knee and run down the outside of the leg. The tendons of the peroneals run right behind the lateral malleolus, and then they come through and attach in some different spots on the foot. You have one that attaches right here at the base of the 5th metatarsal, and then you have a couple that run underneath the foot and attach on some of the tarsal bones. The peroneal muscles produce eversion, or when we pull our foot out this direction. So when these muscles contract, they produce that motion there. On the inside, you have several muscles that come down from the inside of the low leg and wrap around behind the medial malleolus and come down and attach on different spots on the foot. And these muscles will produce inversion, or that motion there where you're pulling your toes in towards the middle of your body. The peroneals and the various muscles on the inside of the leg, the posterior tibialis, the flexor hallucis, the flexor digitorum, they all contract and relax together while you're walking, when you're balancing, when you're doing these things to keep your foot in a neutral position. There are lots of intrinsic muscles in the foot that will help move the toes, but we don't need to really get into those a whole lot because they're not usually injured with sports. When we look at 2 other primary muscles in the low leg is the calf muscles, the gastroc and the soleus. And you can see the muscle belly for the gastroc and the soleus here. And they come down and attach via the Achilles tendon into the calcaneus and the heel bone. Ligaments of the ankle. The most commonly injured ligaments are the lateral ligaments on the outside of the ankle here. And there's 3 that run between the fibula, the talus, and the calcaneus. The first one towards the front is the anterior talofibular ligament, and this is the ligament that's most commonly sprained when you have an ankle sprain. What happens is you kind of roll over that ankle and pull that foot in this direction, and it stretches that ligament and tears right through there. The second one is the calcaneofibular ligament, and it runs just a little bit behind the anterior talofibular ligament. And the third one is the posterior talofibular ligament, and it runs towards the back. So these 3 ligaments right here make up the lateral ligaments, and these are the ones that are injured most oftenly with ankle sprains. On the inside, along the medial side, we have the deltoid ligament, and it runs in several different parts of or bands all along the medial malleolus to the tarsal bones here. This one's not very commonly injured because most of the time when you roll your ankle, you roll it going this direction versus that direction.